What causes the disease? A virus that can be transmitted from one person to the other via blood, contaminated fluids like semen, saliva, etc., or from an infected mother to a newborn.
How serious is the disease and how does it affect the patient's lifestyle?
The patient may have the virus for life and require yearly checkups even if he's asymptomatic at the moment. He may also need to limit his alcohol intake, stop smoking, get the hepatitis A vaccine to protect himself from another infection. In the case of infected pregnant women, they must inform their doctor about their status as carriers so that their babies can be vaccinated.
What is the patient's prognosis?
Hepatitis B, some people rapidly improve, others improve slowly after a prolonged disease, and others have periods of improvement followed by worsening of the symptoms. A small group of people could develop fulminating hepatitis and could die as a result.
What was the patient's chief complaint?
Abdominal pain, jaundice, which is yellow coloring of the skin, and fatigue.
What other symptoms does the patient have?
Nausea, vomiting, loss of appetite, itching.
How was the patient tested for the disease and what does this test reveal?
The patient was tested for surface hepatitis B antigen, the first viral antigen to appear during the infection. His results came back positive.
What were the patient's treatment options?
Usually the infection clears spontaneously, so antiviral agents aren't always needed. Antiviral agents such as adavovir, tenofovir, entecavir, etc. are used mainly for chronic hepatitis B. Although they don't cure it, they reduce the damage to the liver caused by the virus.
What did the patient receive and how effective was it?
Received pegylated interferon for 48 weeks and reduced the viral load in the bloodstream.
What would happen to the patient if he didn't receive the treatment?
It would depend on his clinical history, but in few cases the infection could lead to cirrhosis, which would lead to death.
And now, for last, we wanted to know what new technologies are now existing to prevent and diagnose this disease.
The damage is severe enough a liver transplant may be required. A new treatment introduced recently for chronic hepatitis B is lamivudine, a drug that inhibits the virus's replication.